Let's Talk Nursing is brought to you by bjninform.com, a learning platform for bite-sized, evidence-based content that supports all aspects of nursing. I'm Samina Hashimi, editor of BJ Inform, and in each episode I chat with experts about topics across person-centered care, nurse well-being, and career development. Together, we'll explore their experiences and discuss practical tips and insights that you can apply to your nursing practice. Hello everyone and welcome back to Series 2 of Let's Talk Nursing. I'm so excited to bring to you our upcoming episodes for the new series. We've got some exciting topics lined up and even more exciting guests for you to meet. For this first My Career episode, I'm joined by Aby Mitchell, Senior Lecturer in Nursing Education and Simulation Lead in the Faculty of Nursing, Midwifery and Palliative Care at King's College London. She's recently designed and implemented a simulation-based learning project and virtual placements for nursing students at the university. Thank you so much for joining me today, Aby.
Thank you for having me, Samina. Lovely to see you.
Oh, it's a pleasure. In this episode, we're talking about virtual placements for student nurses, particularly in the context of placement capacity in the NHS. I've seen various proposed solutions to the issues surrounding NHS placement capacity. One of the potential solutions that is gaining a lot of traction, especially since the COVID-19 pandemic, is virtual and remote placement opportunities. But before we kind of get into the details of what virtual placements involve, could you give us an overview of what the reality of NHS placement capacity is looking like at the moment?
Yeah, thank you, Samina. So as you rightly say, placement capacity is under huge strain and the NHS is finding that particularly difficult to manage with rising student numbers, workforce shortages, increasing service pressures and high patient demands. This is also exacerbated by limited clinical staff. And what we're looking for our students is obviously an environment where there is safe supervision. So these growing concerns have been something that everyone's talking about in higher education and in clinical practice. As you rightly say as well, the post-pandemic recovery programmes have contributed to some of the strains on the NHS, and particularly in terms of staff burnout, reduced funding, and all of these have an impact on our students' placement and the placement opportunities we can provide. So expanding placement capacity is one of the things that we're obviously all talking about and need to consider. And the NHS and the national strategic priority of aligning with the government's goal to grow the workforce by 2036. But achieving this growth amidst the ongoing disruption of clinical and educational services presents both challenges and opportunities. In response to this, the NMC have revised their standards and are allowing higher educational institutes to incorporate a portion of this into simulated practice learning. And this is where we need to have conversations and ideas about innovative approaches about how we're going to do this, not only how we're going to deliver this, but how we're going to maintain those standards, the governance around it, and how we're going to be able to check students' engagement and attainment with all of this. So integrating technology and simulation across the curriculum could be a solution, and it could enhance supervision, learning opportunities, and assessment for students.
No, it definitely sounds like there's a clear need to look for other routes into creating placement opportunities for student nurses. And I guess that is where these virtual placement opportunities kind of come into that. So going back to the basics here, what are virtual placements? You know, what do these involve and how are they implemented?
Yes, it's a good question. And I don't think there is one size that fits all. There certainly has been some papers come out and certain universities have done different things. And we're certainly exploring this landscape to see what that might look like in the future. But these are digital solutions. They expand learning experiences and they provide nursing students and healthcare students with exposure to other opportunities, decision-making scenarios, and patient interactions in a remote simulated environment. So they're authentic, they're close to real life as possible, and they give students an opportunity to maybe practice things or have experiences that they may not have already had in clinical practice. They allow them to develop their clinical skills, and hopefully bridge the gaps that placement can't provide.
Simulated practice sounds like quite a broad sort of term. So what does this actually involve? What kind of technology is involved? What does this look like when students are taking part in it?
At the moment, there are a range of modalities that can be used, and my suggestion would be to kind of look to see what you've got at your disposal. Some universities are using things like virtual reality, and there are well-known platforms to be able to deliver virtual simulations, not just synchronously, so in the classroom, but asynchronously, so the students can do that at home. There are AI technologies that can be used to do that as well. And there are 360-degree simulations. So it very much depends on the capacity, the digital capability, and the need of what you're creating that virtual placement to do.
Amazing. Yeah, I think it just makes more sense for me when you sort of can create that visual image of what it actually looks like. And you already highlighted this point a little bit, but what are some of the main advantages that are offered by virtual placements?
Yeah, so as I said, I mean, they're an opportunity to engage in digital health. And we know that the NHS landscape is rapidly evolving. We know that there is more interest in telehealth, virtual care. So this is a really good opportunity for students to maybe learn some skills and maybe adapt some of the skills they currently have to fit within a digital format. Hopefully they prepare students well for the future. And as I said before, give them opportunities that we may not have had before, or even give them opportunities to revisit certain clinical scenarios that maybe they need to consolidate some of that learning or explore on a different level or a deeper level than what they have done before. Virtual placements are scalable, so the opportunity to be able to deliver that for more student numbers, it has the capacity to be able to do that and has the flexibility to do that. So there's opportunity to maybe think about a particular need or a current health concern and how that virtual placement can be structured to meet the needs of those students working in that particular population group. They have broader access to clinical learning, and the different modalities used, as I described to you a minute ago, could mean that different learning styles for students are well serviced. So a student that sees things more visually or is able to do things more hands-on by doing these different modalities give those options and opportunities to students. They deliver an experiential learning experience, and one that could be interdisciplinary, that extends beyond physical boundaries, and it extends capacity.
Yeah, no, that sounds amazing. It's great that it's not just sort of a plug hole for NHS placement capacity issue, but does have its own breadth of advantages that it offers. And I think the sort of accessibility aspect and flexibility is really nice for students as well, and just having different ways of learning and different ways to absorb knowledge, which is, so important even outside of the scope of nursing. And on the flip side now, what are some of the limitations that are presented by these placements?
Yeah, so that's a good question. So although they are very good and they have their place, they don't replace practice, and there's no suggestion that they should do that. As you rightly say, they're there to enhance and to supplement, but not to replace. So virtual placement primarily focuses on non-technical skills, although there are emerging technologies that are starting to think about the technical aspect. So far, it's very much those softer non-technical skills that are really important to nursing care and sometimes need a little bit more practice as well. There are also barriers in terms of technology, so internet access, device availability, compatibility, and digital literacy, and those all may create inequalities with the learners. There are ways to overcome those, but they are something that do need to be considered if you're thinking about a virtual placement. Using these technologies across different countries can present as a challenge as well, and that may limit students' flexibility to maybe access the learning from anywhere, so it may hinder that opportunity for them. And then the asynchronous nature of the virtual placement does require the students to work autonomously. So this needs strong management and organisational skills. And sometimes students find that a bit more of a challenge. So it's about how they work out their ways of working within that different type of environment.
Yeah, that definitely makes sense. And I guess like any new program or initiative, kind of recognizing those limitations early on is really important to then ultimately improving the program as well. And sort of speaking on long term here, what do you think the future of placements for student nurses looks like?
Yeah, it's a good question. As I said, I don't think it's going to replace practice, and I think that needs to be very clear. But I think a hybrid model might be what the future looks like, especially with these evolving digital opportunities, these new immersive technologies, and the outline in the NHS plan. Thinking about placement expansion, we could think about how that is hybrid, strategically integrating both virtual placements to enhance capacity and accessibility alongside clinical placements. And then we could hopefully support growing numbers of student nurses, which is ultimately what we want, is to be able to train more student nurses. There are also opportunities here thinking about what placements look like and thinking about how we might extend that to other members of the multidisciplinary team and other healthcare professionals. For example, physiotherapists who experience limited placement opportunities. Are there ways to collaborate within that? Are there ways to think about spoke placements for secondary and tertiary care? Maybe thinking about the private voluntary sector or even faith-based organisations. And this would then provide students with valuable multi-agency collaborations, broadening their understanding of integrated care.
It sounds like there's a lot of scope for exploration there, from kind of multidisciplinary teamwork to increasing the workforce. So yeah, a lot of really interesting developments for the future. And obviously you have personally implemented a virtual placement opportunity at King's College London. What has your personal experience been around creating and implementing this programme?
So we very much understood that need and that gap. We wanted to think about a digital solution that was one single point of entry where the students could have those experiences that I've spoken about, and so that we could deliver simulated practice learning hours. Our virtual placement at King's College London is mapped against the SSSA standards for supervision and assessment, and we very much aligned that to the practice assessment document. So it would be part of placement for students as well, and it sat under the same kind of criteria and governance of a placement. So far at King's, we've been able to deliver over 10,000 simulated practice learning hours. We developed this virtual placement in July, and we co-designed it not just with clinicians and clinical teachers, but we also had service users involved, and we had students, most importantly, involved to talk to us about that co-design. So we created a hypothetical GP surgery. It sits on the King's Road, and all our patients live on the King's Road. We have over 40 patients currently on our GP surgery caseload, and the students go into what we have built, an electronic patients record system. So they're able to access this record system. They receive a handover in the morning from the district nursing sister, which is an animation, and then they can access the patient records for the day. They can see what the patient's current presenting complaints are. They can see any results, any blood tests. They can see any past medical history, any clinical notes, any referrals. And all of that is accessible for them to see and review before they then see their patients. In our virtual placement, we have several modalities we use for the students to be able to interact with patients. We use AI technology, and we use that not only for students to maybe interact with a patient, but maybe a member of the multidisciplinary team. So, for example, a referral to a social worker or a referral to a GP, or maybe a healthcare assistant, or even a carer or a relative or a neighbour. Our students also interact with a live patient. And we do that through Teams, where we host live patient calls. And so far, we have been able to deliver over 2,300 live patient visits for our students. They meet with the patient on a one-to-one basis. This is a unique opportunity because they have that freedom then to assess the patient. There is no body assessing them in that sense. They can be free to ask whatever they want, gather the data they need to gather, and then they can appropriately use that data to care plan for that patient. We have 360-degree scenarios where they can go in and review patients in a nursing home setting. And we also have patient phone calls where the patient will phone in at some point during the day that they're in the virtual placement, and they will need to respond accordingly and phone the patient back. We also have a structure where all their documentation feeds into the same system. So if they want to complete a care plan, if they want to complete a clinical referral, if they want to order some equipment from our medical equipment library, they can do all that, and it all links into the same database. So we're able to see all the documentation they have completed throughout the day for those patients. And that is reviewed by the academic team working as practice assessors for the virtual placement. And we have clinical teachers who also support that. Our students meet with a practice assessor, so a clinical teacher or an academic, every day at 3 till 4, and we offer supervision. So they're able to talk through what they've done in the virtual placement, how they found it, any difficulties, and also talk through some of their patient assessments. So to think about whether, they did the right thing, whether they might think about something else, whether they want to review medication, whatever it is that comes up in those sessions. And they are facilitated in groups of 10. And the other thing we do within the week of the virtual placement is we book a joint visit with our students. So one of their live patient visits, they will have the practice assessor attend that joint visit with them and give real-time feedback. So straight after the visit, we give them just an overview of what we think went really well and what we think they might want to think about the next time they meet a live patient in the virtual placement. All of our virtual placement is linked to a data analytics dashboard. And in the data analytics dashboard, we are able to see in real time exactly what the student's journey is through the virtual placement. So we can see how long they spent with an AI interaction. We can see what documentation they completed. We can see whether the service user or the patient has given them any feedback because they have a feedback mechanism to do that. And all of that's captured in that one system. So we're then able to understand what the students have achieved during the day, and we're able to attribute simulated practice learning hours for their time in the virtual placement.
Since there were so many elements involved, how long did it take to set all of this up?
So it took us a long time to build it. The initial concept was evolutionary, really. So we started with something quite small, and we looked at what we had in-house, what digital solutions we already had in-house, and how they would work. And then we built slowly on that. So what else did we need? And all the way along that process, we tested that with students, with service users, and with clinical teachers. We wanted it to be as authentic as possible, as realistic as possible. It's set in a community. So my background is district nursing. So I felt able to maybe think about what that was like being a district nurse in that community. But we also wanted it to be representative of the London population. So in that, we have a diverse patient background. And so we needed additional support to create some of those scenarios to make sure they're realistic and they're representative of what the London population patients need. So we reached out to the trans community, we reached out to the BAME community, and we reached out to the learning disability community as well to ensure that we had all of that in place for the students.
That's fantastic that you reached out to those specific communities and had that first-hand sort of insight into what these patient populations need. And obviously, this was a very complicated and thorough process. What were the biggest challenges that you encountered while setting this up?
Yeah, so that's a good question. And when we first ran it in July, we have so many lessons learned actually from those encounters. I think the first thing we learned from it was that this was new, this was novel, this was innovative, and we really needed to prepare our students for that. So we developed a student training package, and we gave that to the students before they started the virtual placement. But we now know that we need to give them that further in advance, so they've got more time to maybe take at looking at that information and maybe to raise some questions. And we also know now that we needed to provide more drop-in sessions to the students so that they could come in the virtual placement while they were actively working there to ask any questions or to troubleshoot or to just to pick our brains about something. So we learned that very quickly within the first iteration. We also learned very quickly that our tracking and monitoring and data analytics needed slight refinement so that the students could report things themselves. We hadn't quite considered that. We considered the practice assessors reporting, and myself and the digital learning specialist, Benham, who built the electronic patient record system. We understood that we needed to do that, but we didn't know that the students did. So we gave them abilities to maybe report absence, maybe to flag things up, maybe to make contact and communicate. And we gave them all the forms and channels and teams to be able to do that. We also learned that we needed to give a little bit more information about primary care services and what the role of the district nurse looked like, and the role of the multidisciplinary team and how they integrate together, and also the integration between secondary and primary care. So we have created further information in the training package to be able to prepare our students for that before they start the virtual placement.
You mentioned before this recording that you've begun the second iteration of the program now. How's that been going so far?
Yeah, so it's been going really, really well. We took the lessons that we'd learned. We also, the second iteration, students had already done the virtual placement once before. So they'd learned quite a lot along the journey as well. And we were able to incorporate a lot of that in how we built the second one. We're actually now in our third iteration. We've just started it. And we're very much building this in a bespoke way to sit with an optional module for cancer care. So these are patients that represent that community and how students will interact with that as part of that optional module. So it's going great. The students' response is really, really positive. They like the autonomy. They like the fact that they get to work independently. Some of them say, I really feel like I am actually a district nurse working with my caseload, and they're enjoying that. The students have also commented that those that have had community placements since they did the virtual placement, they felt better prepared for their community placement. They felt like they knew a little bit more about what was going on and what was expected and how to manage day to day in the community. They enjoyed learning about communication skills and history taking and maybe gathering that data, which sometimes they don't have enough time to do that. There was really a great emphasis on them being able to collect as much data as they needed within the virtual placement to make informed decisions about care planning. They particularly enjoyed using the AI platform because it gave them an opportunity to have some difficult conversations. So one of our characters in the second iteration is a young man who's having sex with another man. And our students don't always have those opportunities to have those interactions, but also they found that very difficult and quite a challenging conversation to have. And they really enjoyed the opportunity to practice that with an AI rather than with a real life person. They liked the fact that they were able to independently fill out things like safeguarding referrals or Datex forms. Like they could make a decision about what commode the patient needed and be able to order that from the equipment catalogue. And they really liked the opportunity to be able to take time to look at the soft signs of deterioration in a patient, particularly in low mood, mental health, and think about what interactions and what differences they could make to that patient's care. Overall, they felt that it increased their confidence and they gained knowledge about different assessments and the links between physical, psychological, and social health, and how to prioritize these, and how this then links to communicating to other members of the multidisciplinary team and how to work collaboratively within that scope of that practice with that patient. We also received feedback from staff members, and they told us what they thought of the virtual placement as well, which is very interesting. So they liked the fact that they could see the students' journey. They could see the students growing in confidence before their eyes. In the beginning, they were really hesitant. This is a very new experience for them. And by the end, they were mastering some of the technical stuff and being able to focus much more on the patient care that they were delivering. They liked the fact that there was a variety of scenarios, and this was a really unique place to be able to do that. No day was the same, very much like working in district nursing practice. You don't know what you're going to get and when you're going to get it. And they liked that about it because it added to the richness of those supervision conversations and the deeper learning that the students may achieve. And they really liked the fact that the students were taking ownership and they were delegating and they were showing those kind of leadership, team working and delegation skills within the placement.
Oh, amazing. Yeah, it sounds like, both staff and students really recognise that this was just a nice, safe space for students to be able to pick up on those skills, and especially those difficult skills like the difficult conversations. I feel like if you were thrown in the deep end in a clinical placement and immediately had to have a really challenging conversation with, a patient who is maybe a man who has sex with men or someone else with a really specific, really sensitive concern, and being able to make those mistakes and knowing that it's okay and you're not actually affecting a person and their life, that must have been really reassuring and also really beneficial for their confidence and competence in the long term as well. No, it's amazing that you had the initiative and opportunity to create this program, and it sounds like it's created really good long-term learning opportunity for students as well. Now I'm going to ask about your 3 key actions. So these are 3 important practical actions that you would recommend nurses to start implementing. So what is the first key action that you would recommend?
So my first key action would be think about what kind of digital solutions you have within the area that you work with, and think about how you might be able to use them to enhance placement opportunities for students and to combine those different learning modalities using digital and immersive technologies.
And what is your second key action?
So my second key action would be to think about developing a psychologically safe simulated environment for students to practice technical and non-technical skills, enhancing their confidence and preparing them for placement.
Mm-hmm. And finally, what is the third key action that you would recommend?
Well, I think the third key action has to be to address some of the technology barriers, because I think that is one of the things that will come up. So I think providing training on digital literacy, telehealth competencies, and offering structured guidance to help students navigate asynchronous learning, develop strong time management skills, and adapt their self-directed learning environments.
Thanks for sharing those actions. They sound like really practical insights that anyone who's looking to create a virtual placement would really benefit from, especially that final point about digital literacy, because I think we'd all be surprised how little we actually know about how to use technology sometimes. So now to wrap up the episode, we're going to look at a scenario-based reflective question. So I'm going to share a scenario around implementing a virtual placement, and Aby, you're going to give some advice on what you would do in this situation. So the scenario is you are required to deliver simulated practice learning hours with limited resources. What digital solutions and modalities could you use to deliver this? So Aby, I don't know if you've ever found yourself in a similar situation like this, but what would you do if you were this person?
Yeah, so this is a great question, I think, because I think the first thing I'd look to is my mobile phone. I'd look to what I could achieve using my mobile phone. I can achieve videos, I can achieve voice calls, I can achieve voice recordings. So all of those different modalities I could use maybe to simulate an environment for a student. I would also look to what we had within our capacity. Most places these days have some kind of Zoom or Teams function. And very simply, we can set up those virtual clinics and set up some hybrid solution whereby there are students in one room and there's somebody else in another room, or maybe everybody's virtually connected. And we could do that individually, like we do in the virtual placement, or we could do that within groups, small groups, large groups, depending on the need and the capacity allowed. I would think about doing things slightly differently. So I would think that it doesn't always have to look like what we think traditional simulation should look like. It doesn't have to be a mannequin or a simulated trainer or something like that. Simulation is about creating real life. It's about doing something that looks like a patient would experience at some point on that healthcare journey. Only yesterday, I logged into my NHS app on my phone and ordered a repeat prescription. And I think those are the kind of things we can think about enhancing and allowing technology and what we already have to kind of lead us to build those learning opportunities around them.
Yeah. Oh, well, amazing. Thank you so much for sharing that advice. And that essentially brings this episode to an end. So thanks so much for joining me on the podcast, Aby. It's been an absolute pleasure talking to you.
Thank you so much, Samina. Thank you for having me.
If you enjoyed this episode of Let's Talk Nursing, do follow us for new episodes and share with your colleagues. For more resources and past episodes, visit bjninform.com. Thank you so much for listening and see you next time.